Hello everyone. So today I will be discussing about the parasitic infection, specifically the Helmenthiasis. So we will be exploring its definition, the signs and symptoms, the complication, the pathophysiology, the treatment, the prognosis, and the diagnosis of the disease. So starting off Helmenthiasis. So let's first define what is Helmenthiasis. Helmenthiasis is also known as a worm infection. It is any macroparasitic disease of humans and other animals in which part of the body is infected with parasitic worms, also known as the helminths. So this is a type of parasitic infection which is caused by certain parasite that could invade an organ or different part of the body that make us sick or get the disease. How does this transmitted? So, helminthiasis are transmitted in several ways. So the most common infection is through drinking contaminated water and raw or uncooked meat. So there are several types of diseases under helminthic parasite. First is Ascariasis, and the next is Ancylostomiasis, then Enterobiasis, Paragonimiasis, Strongyloidiasis, and then Taeniasis. Next is Fasciolopsiasis and Trichinosis. So let's define each. So these are the different parasites of Helmenthiasis. There are three types: the nematodes, also known as the roundworms; the cestodes, which is also known as the tapeworms; trematodes, which is the flukes; and these are the pictures of the Helminthiasis types of worm. So nematodes is one of the abundant animals on earth. They occur as parasites in animals and plants or as a free living form in soil or fresh water. The cestodes, they usually live in the human gastrointestinal tract from eating a raw or uncooked pork or meat. And then the trematodes or the flukes, these are the significant number of trematode infection that are transmitted by consuming contaminated food from water plants or in fish or mollusk. So these are the sites for or location for helminthic infection in humans. So these are usually be found in the alimentary tract caused by ingestion of the parasitic worm or parasitic parasite. So in the alimentary tract, they are found in the mouth, the pharynx, the esophagus, in the intestines, or specifically in the small intestine or in the large intestine. The next site is in the cavities, organs, and tissue of the body. Also, they are also found in the circulatory system and in mostly in the skin and subcutaneous tissue. So this is the pathologic processes of helminthiasis. So first off, in the fecal oral contamination via hand or mouth. So human to human transmission usually is caused by pinworm or threadworm. Um, Female lay eggs in the perianal folds. Usually the larva mature with a time span of 4 to 6 hours. So embryonated eggs ingested by humans. Usually the host ingests eggs or eggs hatch and release larvae. And then the larvae will hatch in the small intestine or the larvae will invade in the intestinal walls. The next is adults in the lumen of the cecum. And last, for the human to human transmission, well, the gravid female migrates to the perianal region at night and lay eggs. And into the soil transmitted helminthiasis, usually they are the roundworms. So fertilized eggs ingested in food or soil. And the eggs become larval worm and penetrate the wall of the duodenum and enters the venous system from the liver to the heart. So, larvae migrate to the pulmonary circulation, usually in the lungs via the portal vein. So, the larvae migrate into the alveoli, the trachea, and larynx. So, the larvae returns to the small intestine where they are mature into adult. And then the eggs pass in the feces. Infected larvae develop within fertilized egg in soil where they can persist in the soil for 10 or more years. So the types of diseases under Helmenthiasis. So the first type is Ascariasis, which is also a roundworm. So it is an infection of the small intestine caused by Ascaris lumbricoides. So this is the most common helminths in the world, which is a species of roundworm. So the pathogen of Ascariasis is Ascaris lumbricoides, which is a giant type of roundworm. And Ascaris are also nematodes. So the epidemiology of this disease is the most common helminth infection of the world, mainly affects children in the tropical countries with low standard of hygiene. So the mode of transmission is fecal to oral. So this infection occurs in the larval state following the consumption of contaminated food, or especially the raw vegetables that have been contaminated by human waste, or such as fertilizer from feces or human feces. So there are clinical features or signs and symptoms of ascariasis. So several abdominal pain, fatigue, vomiting, weight loss, malnutrition, a worm in the stool or from vomiting. On diagnostic exam are CBC, which shows eosinophilia, confirmatory tests to check for the stool exam if there are worms can be found in the stool through examination. And then sputum analysis also is the chest radiography. So are the treatment of choice is bendazole. So this is a medicine for ascariasis. Then the next is Ancylostomiasis, which is a hookworm. It is a hookworm disease caused by infection with Ancylostoma hookworms. So the pathogen of this disease is Ancylostoma duodenale or the Necator americanus. So the mode of transmission is the larva mature into a form that can penetrate the skin of humans. So hookworm infection is transmitted primarily by walking barefoot or on the or any contaminated soil which the parasite is invading, and it will penetrate through the skin. So the clinical manifestations are rash from the site of larval entry, abdominal pain, vomiting, diarrhea, and diarrhea. So the diagnosis are microscopic examination. So in microscopic examination, the stools of the human or the person infected is checked to microscope. So diagnostic exam for this disease is microscopic examination. So the stools will be carefully examined and by inspecting the skin, eyes, and visceral. So identifying eggs in the stool. So possible complications are iron deficiency, anemia caused by loss of blood, nutritional deficiency, severe protein loss with fluid buildup in the abdomen or ascites. Then the next type is Enterobiasis, which is also a pinworm. So pinworm infection, an infection caused by a small white intestinal worm, or the pinworm, or more formally the pathogen, which is Enterobius vermicularis. So the mode of transmission is fecal to oral route. Then the signs and symptoms of this disease is itching of the anal or vaginal area where the parasite invade. Then insomnia, irritability, teeth grinding, and restlessness. Also, manifestation of stomach pain and nausea. So the diagnostic exam for this disease is Scotch tape test. So this test look for an egg from a perineal region under microscope to identify the specific parasite that invade into the perineal region. The complication is the complications are tubo-ovarian abscess, appendicitis, endometritis, urinary tract infection, and vulvovaginitis. Then the next type is Paragonimiasis. So it is an infection with parasitic worms, also known as the flatworm. So it is caused by eating undercooked crab or crayfish. And Paragonimiasis can cause illness resembling pneumonia or stomach flu. So this infection can last for years. So the mode of transmission is by eating an infected crab or crayfish that is either raw or partially cooked meat. So the clinical manifestations are fever, malaise, diarrhea, belly pain, and itching. So the diagnostic exam or procedure for this is microscopic examination to check for the sputum and the stool for presence of parasitic disease or parasitic worms. The complications are interstitial pneumonia, bronchitis, and bronchiectasis. So the next type is Strongyloidiasis, which is a roundworm type of infection or nematode called the pathogen Strongyloids stercoralis. So the mode of transmission is through soil, so soil transmitted helminths. So this means that the primary mode of infection is through contact with soil that is contaminated with a parasite or free living larva. So the signs and symptoms are the upper abdominal burning or pain, diarrhea, and constipation, cough, rash, red hives near the anus, vomiting, weight loss. So diagnostic exam is blood tests and stool examination, also to check for the presence of parasite. Complications are pulmonary complication, the asthma, pneumonitis, acute respiratory distress syndrome, and granulomatous lung disease. Then next is Stenyasis. So it is a type of infection within the intestine by adult tapeworm belong to the genus Taenia. The mode of transmission is ingestion of undercooked pork, which is presence of parasites invade onto that specific pork or infected pork. So this means that human can be infected by ingesting raw or undercooked infected meat. So the clinical manifestation is abdominal pain, loss of appetite, weight loss, and upset stomach or pain. So the diagnosis for this is stool samples. So it will the stool examples will be tested for presence of infection or parasites. Complication are intestinal obstruction, obstruction of bile ducts or pancreatic duct leading to cholecystitis, acute pancreatitis, granulomatous gastritis. So this is how um, humans are infected by ingesting raw or uncooked infected meat. So it started off through the pass into the environment of eggs or feces, and then the cattle or the pigs become infected by ingesting vegetation contaminated by eggs of the parasite, and then this parasite will penetrate into the intestinal wall and circulate to musculature, and then humans will be infected through eating the undercooked infected meat. If not properly cooked or partially cooked, they will be infected. And then adults will also grows into or mature into the small intestine. This stage will be circulate all over again through feces or that will be passed into the environment. And then next is Fasciolopsiasis. This is a type of intestinal fluke, Fasciolopsis boschi, which is acquired by eating aquatic plants. Mode of transmission is ingestion of undercooked contaminated water plants. Clinical manifestations are abdominal pain and diarrhea. And then the diagnosis is stool examination to also check for presence of parasites. And then the complication is intestinal obstruction, abdominal pain, nausea, vomiting, and fever. Trichinosis, also known as the trichinolosis, a parasitic disease caused by roundworms of the Trichinella type. So the mode of transmission is ingestion of undercooked meat. So clinical manifestation, nausea, vomiting, diarrhea, fatigue, fever, and abdominal discomfort. And the tests are blood test and muscle biopsy. Complications could be myocarditis and encephalitis. Nursing diagnosis: risk for impaired skin integrity related to intense perianal scratching. Acute pain related to smooth muscle spasm secondary to migration of parasite into the stomach. Next is imbalanced nutrition less than body requirements related to anorexia and vomiting. Then hyperthermia related to decrease in circulatory secondary to dehydration. Lastly is fluid volume deficit related to fluid loss secondary to diarrhea. So these are the nursing management. So proper hand washing, which is an effective in preventing the disease transmission. Then the personal hygiene or changing personal habits of such as thumb sucking or nail biting, which may be there may be a presence of parasites in the nails or in the hands. Also improve fluid and electrolyte balance. So it is important to monitor intake and output of fluids. And then improve nutrition. So give adequate and nutritious food to the patients. Reduce pain and discomfort. So teach a method of distraction or to reduce pain techniques. So treatment or treat treatment. So medication such as broad spectrum benzimidazole such as albendazole and mebendazole. So these are the first line treatment of intestinal infection, particularly from the roundworm and the tapeworm. Mass deworming treatment may be performed in the areas where helmenthiasis is common, particularly among high-risk group and school-aged children. So the last treatment is surgery. If complications such as intestinal obstruction occur, emergency surgery may be acquired. So we have to remember this word, time. So when it comes to sepsis, we have to remember it's about time. So watch for T stands for temperature. We have to check for our temperature for Either it's higher or lower than the normal. So I stands for infection, maybe may have signs and symptoms of infection. We have to watch for it. M for mental decline. So usually these symptoms could be confused, sleepy, or difficult to rouse. And lastly, for E, which is an extremely ill, we have to watch for severe pain, discomfort, or shortness of breath. Tips for preventing parasitic disease. So, wear gloves when gardening and cleaning litter boxes. So, we should always wear gloves so that the parasite won't invade our hands or will not penetrate into our skin. Next is fully cooked meat. So, we need to make sure that we completely cook the food or the meat so that we will be able to prevent the certain diseases from or certain parasite that is present in the meat, or we won't be able to ingest them. And the next is wash fruits and vegetables. So we need to make sure that our vegetables and fruits will are washed completely or properly. Prognosis. So prognosis of helminthiasis depends on the extent of helminth infection. So if the worm burden is high, ascariasis may produce some serious complications such as intestinal obstruction. And a Strongyloidiasis carries a good prognosis, although hyperinfection syndrome and disseminated Strongyloidiasis carry a high mortality rate.